On this model, or vessel plaque, I want to discuss some of the major vessels of the body. There are some things we can see on this plaque a little better than the other, and some on the other that were better than this. So I'm going to start looking at the area of the heart, and we're going to start with arteries and work our way out, and then we'll do veins and come back. Starting at the heart, of course, we have the ascending aorta, the aortic arch, and then the descending or thoracic aorta. That aorta will descend posterior to the heart, and as it passes through the diaphragm at the T12 vertebral level, it will become abdominal aorta. We'll talk about that shortly. Going back to the aortic arch, we have the three branches of the aortic arch, the brachiocephalic trunk. Keep in mind, brachio means arm, cephalic means head, so brachiocephalic trunk basically means the arm and head trunk. It passes posterior to the vein here, which we haven't named yet. I'll talk about that in a few minutes, to divide into the right common carotid artery and the right subclavian artery. So here's brachiocephalic trunk dividing into right common carotid and right subclavian arteries. The second branch of the aortic arch is the left common carotid artery, and it will move upward in the neck and branch into internal and external carotid arteries. On this plaque, we can't see the internal. And mostly what we see of the external that I'm going to focus on is a branch called the facial artery, which runs across the mandible and up into the face. So brachiocephalic trunk, left common carotid artery, and then left subclavian artery. Left subclavian artery will supply blood to the left upper extremity. Now the subclavian arteries only run as far as the lateral border of the first rib. So here's our first rib. Right there, it then changes name. So we have subclavian artery to here. Then it becomes axillary artery. Your armpit is known as the axilla. The artery running through the armpit is the axillary artery. Let's hop over to the right side for a second. Again, subclavian artery to here, because here's our first rib. Then axillary artery. Axillary artery runs until the lower border of the teres major muscle. However, we don't have the muscles on this model, so we don't have anything to go by for that landmark. However, there is a branch of the axillary artery that goes behind the surgical neck of the humerus. Right here we have our surgical neck of the humerus, and we can see a branch right here going posterior to that surgical neck of the humerus. That is called the posterior circumflex humeral artery. That is the last branch of the axillary artery. So we know that at this point this was still axillary. So somewhere right in here, this artery changes to the brachial artery, which literally means the arm artery. So the artery of the arm. Brachial artery passes along in the anterior arm, and as it gets near the elbow, passes in the cubital fossa anterior to the elbow and branches into the radial artery, which follows along the radius, and the ulnar artery, following along the ulna. Now there are several branches in that area. Some are depicted on this model, others are not. You are not responsible for those branches in A&P2. Now as we get down into the wrist, we will see branches from the ulnar artery and branches from the radial artery form arches within the hand. There is a superficial palmar arterial arch and a deep palmar arterial arch. On this model, they only depict one palmar arterial arch. And then from there, we have the arteries that will go out to supply the digits. If I look at the left upper extremity on this model, or this particular plaque, we see some things that we didn't get to see real clear on the right side. Subclavian to here, that's first rib. Axillary to about here. Now, they didn't show the branching of the posterior circumflex humeral artery, but here's the artery coming behind the surgical neck of the humerus. So we'll make the assumption that this should have been connected right here. So axillary to here, then brachial. The brachial artery, again, we said runs down the anterior arm, but about midway down the shaft of the humerus, it sends off a branch that also will go posterior to the humerus in what is called the radial or the spiral groove. That is called the deep brachial artery, also known as the profunda brachii. So on this model right here, this is our profunda brachii artery, traveling in what is known as the radial or spiral groove. Again, we follow the brachial artery, and as we get to the elbow, pass anterior to the elbow and divide into radial and ulnar arteries. But on this plaque, we've pronated this forearm so we lose the relationship, so I'm not going to continue on with the vessels on this side. So what we saw on this plaque that we didn't see real well on the other was this deep brachial artery, or the profunda brachii artery. Let's move into the abdomen for the vessels. And again, following arteries, we already know that we have the abdominal aorta, which came through the diaphragm at the T12 vertebral level. And at T12, that abdominal aorta sends out a series of branches. This plaque is a little bit misleading, as was the other. This looks like one structure coming out and branching into 4 branches. It is not. It is actually this vessel by itself, and then the other structure comes out and branches into 3 branches. This vessel coming up on the bottom of the diaphragm is known as the inferior phrenic artery. And there really should be 2 of those, one toward the right and one toward the left. Inferior phrenic artery. This other branch is known as the celiac trunk. The celiac trunk is a very large artery in diameter. It's almost big enough to put your little finger inside. However, it's very short. In most people, it's not much more than 1/4 to 1/2 inch long, and then it immediately divides into 3 branches, and we can see the branches here. 1, 2, and 3. One branch goes over to the liver. It is called the common hepatic artery. Another branch goes to the spleen. It is called the splenic artery. And the third branch goes out onto the upper part of the lesser curvature of the stomach. It is called the left gastric artery. So here we have the celiac trunk with its common hepatic, left gastric, and splenic branches. So although this looks like one with 4, this is an individual artery. This is the celiac trunk. All of that occurring at the T12 vertebral level. At the L1 vertebral level, we see a large vessel coming out of the abdominal aorta to supply viscera in the abdomen. This is called the superior mesenteric artery. The superior mesenteric artery is going to have branches that go to part of the stomach, the duodenum, the jejunum, the ileum, the ascending colon, and part of the transverse colon. So much of our abdominal viscera. That is at the L1 vertebral level. Also at the L1 vertebral level, we can see coming from the abdominal aorta, vessels leaving the aorta and going into the kidneys. These are the right and left renal arteries. Left renal artery, right renal artery. Notice that they are posterior to the renal veins, and on this side it's very obvious, posterior to the inferior vena cava. We'll talk about that more in just a second. So at the L1 vertebral level, the superior mesenteric artery and the renal arteries. This plaque does not show at the L2 vertebral level the gonadal arteries, which we saw on the other plaque. However, at the L3 vertebral level, it does show the inferior mesenteric artery. The inferior mesenteric artery will supply part of the transverse colon, the descending colon, the sigmoid colon, and the upper part of the rectum. Then at the L4 vertebral level, the abdominal aorta bifurcates, and we no longer have abdominal aorta. It bifurcates into the left and right common iliac arteries. Those in turn branch into the internal iliac arteries, which dive into the pelvis, and the external iliac arteries, which are going to head out into the lower extremities. So at L4, the abdominal aorta bifurcates into common iliac arteries, which will in turn bifurcate into internal and external iliac arteries. Also at L4, there is one artery that continues down into the pelvis called the middle sacral artery. Now on this model, they've shown it much larger than it should be. That would be our middle sacral artery. The external iliac artery will become the femoral artery, and it does that when it passes underneath the inguinal ligament. The inguinal ligament connects our anterior superior iliac spine to our pubic tubercle. So the inguinal ligament would be roughly right about here. So here we would have external iliac, here we would have femoral artery. The femoral artery passes initially in the anterior thigh and then works its way to the medial side of the thigh and then passes through a structure known as the adductor hiatus to go posterior to the knee. When this femoral artery passes through the adductor hiatus, its name changes. It will then become the popliteal artery. So femoral starts in anterior thigh, works its way to medial thigh, through adductor hiatus, goes posterior to the knee. At that point it becomes the popliteal artery. Now there was a lot of things happening at this femoral artery when we first entered into the thigh. At the level of the pectineus muscle, we have three things happening. We have a branch coming off of the femoral artery and diving deep into the muscles of the thigh. It is called the profunda femoris artery, also known as the deep femoral artery. And we can see it passing here, and we know this is the profunda femoris because it has perforating branches that will disappear behind the femur. So we can see one here, another one here, and another one here, disappearing behind the femur. So this is our profunda femoris artery with its perforating branches. The other vessels that branched from the femoral artery at this level are the medial and lateral circumflex femoral arteries. Now, I said from the femoral artery, they may branch from the initial portion of the profunda femoris, but we're going to say from the femoral in this case. Now, this plaque does not show the medial circumflex femoral artery on this left lower extremity. It does show the lateral, and I know this is the lateral femoral circumflex because it passes anterior to the femur. And here we can see its ascending branch and its descending branch. There is a third branch that is not depicted. There should be a branch going to the medial side and then behind the femur. That would be the medial circumflex femoral artery, not depicted on this model. Now if we hop over to the other side, we can see a little bit of that. We can see the femoral artery coming in, then they've cut a piece out so we can see what's going on. Here we can see part of the lateral femoral circumflex, maybe medial femoral circumflex here, and we can see a pudendal artery here, but I do not believe you'll be responsible for pudendal artery. And then we can see the femoral artery as it passes down and it goes posterior to the knee where it would be popliteal artery, and we see a branch here. Maybe, depending on whose course you're in, you may need to know this branch. This is called the saphenous artery. It comes into the femoral artery, or actually comes off of the femoral artery, and goes to the medial aspect of the knee. Hopping back over to the left lower extremity, notice on this left lower extremity we've rotated it. We've done a lateral rotation of this extremity, so we're looking at the medial side of this lower extremity. We've seen that as we went behind the knee, the femoral artery changed its name to popliteal artery. That the popliteal artery stops being popliteal when it branches into an anterior tibial artery and a posterior tibial artery. On this plaque, we can see the anterior tibial artery passing lateral to the tibia and then running in the anterior leg as anterior tibial artery and then out onto the top of the foot as the dorsalis pedis artery. We can follow the posterior tibial artery as it goes behind the medial malleolus of the ankle and becomes the medial and lateral plantar arteries. Because we've rotated this lower extremity, we're looking at the medial aspect of the foot, so this must be a medial plantar artery. Now there should be another vessel branching in here known as the fibular artery or peroneal artery. It is not depicted on this particular model. Now on the other side, it's much like the other plaque. We lose things at the knee. There's a lot of anastomosis going on at the knee. These vessels do have names. You will not be held responsible for them. But here we can see that anterior tibial artery running down the anterior aspect of the leg and out onto the dorsum of the foot to become the dorsalis pedis artery. Let's take a quick look at the veins on this model, and then we can wrap up the blood vessels. Keep in mind that all veins are trying to return to the right atrium of the heart. And we've seen in our heart videos the superior vena cava and the inferior vena cava. So let's start with this superior vena cava and talk about blood supply coming back to the heart. This inferior vena cava was formed by the union of the left brachiocephalic vein and the right brachiocephalic vein. This left brachiocephalic vein was formed from the union of the left subclavian vein and the left internal carotid vein. The same on the right, except instead of left, it's right. So here we had the right internal, excuse me, not carotid, but jugular, internal jugular vein and right subclavian vein. So on this side we had the left subclavian vein and the internal jugular vein, left internal jugular vein, to make left brachiocephalic vein, right brachiocephalic vein. The left subclavian vein came from left axillary vein, which came from left brachial vein. So the naming is the same as what we had as the arteries were going out, and the landmarks are the same. But we can see the subcutaneous veins on this plaque, which are necessary to know if you're going to be a phlebotomist, if you're going to donate blood, if you're going to put in lines for IVs. So starting near the wrist, running along the medial aspect of the forearm and then the medial aspect of the arm and ultimately into the brachial vein, we will see the basilic vein. So here we have the basilic vein along the medial aspect of the forearm and arm. Along the lateral and slightly posterior in the forearm, we will see the cephalic vein, and then it travels along the lateral aspect of the arm and then goes over into the axillary vein. So here is our cephalic vein traveling to the axillary vein. The other vein we can see in this forearm is the anterior median vein of the forearm. And as it nears the elbow, this pattern is highly variable, but on this plaque we can see it forms what is called the median basilic vein heading over to the basilic vein, and the medial cephalic vein heading over to the cephalic vein. So if you're wanting to put in IVs or draw blood in that cubital region, it's important to know the pattern of your particular patient. If we look in the abdomen, as we had an abdominal aorta bringing blood out, we have the inferior vena cava bringing blood back to the heart. The inferior vena cava was formed in the abdomen by the union of the common iliac veins. So we really should start at the foot and work our way back in. But let's start with our inferior vena cava inside the abdomen and look at the drainage of the abdominal viscera before we do the lower extremity. The inferior vena cava is going to pick up, at least on this plaque, the renal veins at the L1 vertebral level. Notice the left renal vein crossing anterior to the aorta, and the right renal vein coming directly into the inferior vena cava. At the renal hilum, those renal veins are the most anterior structures. Then this inferior vena cava simply passes by the liver and through the vena caval hiatus to the right atrium of the heart. As it's passing by the liver, it is going to pick up the hepatic vein, venous blood coming out of the liver into the inferior vena cava. Now on this particular vessel plaque, they painted them the same color. Makes the other plaque a little bit better. There are vessels that ultimately join to form what is called the hepatic portal vein. This is blood from our abdominal viscera into the liver. So draining the stomach, the small intestine, the large intestine, and the spleen. Here we can see the splenic vein coming over, and here we can see the vessels from the remaining abdominal viscera. They're going to unite and form what is called the hepatic portal vein. That hepatic portal vein is taking that venous blood into the liver, where the liver can detoxify the substance in the blood, do some glycogen, glucose transfer, things like that. So into the liver with hepatic portal vein, out of the liver with hepatic vein. So do not confuse those two. That is better seen on the other vessel plaque. Let's look down at the lower extremity and work our way back up to form this abdominal aorta. The veins in the lower extremity have the same names as the arteries. So the arteries were going out, the veins were coming back, and by and large they have the same names with the exception of the small saphenous vein and the great saphenous vein. And on this plaque we have a really good view of the great saphenous vein. It begins on the medial aspect of the ankle and ascends the medial aspect of the leg, the medial aspect of the thigh, where it will dump into the femoral vein just before it becomes the external iliac vein. So this is our great saphenous vein. This was our femoral vein that on this model has been cut off. We pass underneath the inguinal ligament, we become the external iliac vein. Right and left external iliac veins. Coming out of the pelvis, we have the right and left internal iliac veins. Internal iliac veins and external iliac veins unite to form common iliac veins. The common iliac veins unite to form the inferior vena cava. That should be all of the vessels that you would be responsible for on this particular model.